Thank you so much for being here with me, Dr. Khowaja. I am excited to have you. And everybody watching, this is Meet Dr. Khowaja. He's a diplomat, American board of diplomat, American Board of Neurology and Psychiatry. He's a medical director at Dare Oaks, Texas. That is just briefly about him. But on a personal level, I've had the opportunity of being supervised by him. He was my supervising psychiatrist working with elderly people. And I must tell you, he did not spare me, thankfully, and I learned a lot. And I learned a lot from him, right from his wealth of experience, the knowledge, all the way to the way he relates with patients at the bedside. I learned a lot from him. He's been a true leader to me and a mentor when it comes to psychiatry, and even in relating and communicating with people. So this is, you can tell how excited I am to have him here. So trust me, you'll be getting the best from this session, and I want you to please pay full attention to everything he will be saying, because you don't only need it for yourself, we also need this for the people around us. Thank you for being here, Dr. Khowaja.
Thank you.
So, diving right into it, I want us to start from the very, very foundation. Dr. Khowaja, what is mental illness?
Okay, so mental illness is something that has grown into a very ambiguous, not fully understood branch of medicine. And there is reasons for that. We species, human, are visual species. We use eyesight as the most important way of evaluating things. That's why when you understand something, you say, oh, I see. You don't say, oh, I smell, oh, I touch. You say, oh, I see. So we are almost slaves of our sight. When you see a broken bone, you see it. It becomes real to you. When you see a cut on the skin and you see blood, it becomes real to you. You want to do something about it immediately because that is not real. But brain diseases present in two ways. One are those that are obvious, for example, a stroke, that you will rush to the doctor because you can see it abnormal. The other part of the brain disease does not show that you can see with your eyes. That is the disorders of the way you feel, the way the brain functions, the functionality of it rather than the obvious distortion of the anatomy. Those diseases are called mental illnesses, or to me, they are still brain diseases. So let me give you a few minutes of orientation of what the brain is like in a human brain. So from an evolutionary point of view, we are the most evolved species. Every human brain, yours, mine, and anybody who is on the planet, has three brains into this one brain. So the brain has three distinct parts. The first, the basic, is the reptilian brain, what we call brainstem. That is what evolutionary first part of the brain, which controls your functions of sustaining life. So heartbeat, breathing, temperature control. Reptiles have that. That is the reptilian brain that is deep in the backside of your brain. Then human evolved to become emotional. So the second layer of neurons built over millions of years from an evolutionary point of view, and that part of the brain became what we scientists call limbic system. That is where you feel the emotions. Dogs have it too. Humans have it more evolved. And the last part of the brain that evolved, which is in evolutionary terms most recent, which is called neocortex. The word neo means new. That is your frontal lobe, your prefrontal lobe, the other areas that you actually see when you see the picture of the brain, those lines, the curves, that goes on top of the limbic system. So every brain has three brains in it. Now think about it this way. The latest layer, the neocortex, the cerebellum, controls most of the things that you see. So the eye move, the arm, the muscle movements, the speech, all right? When you have a disease in that part, you see a stroke. The arm wouldn't move. The person cannot talk. And you can recognize it because you can see it.
Mm-hmm.
The problem is that the second brain, the limbic system, that is the center of your emotions, presents itself in emotional expression. You may feel depressed, you may feel anxious, you may have unusual fears. These three parts of the brain are interconnected. So if you have a stroke, you can have depression from the stroke, but they are also connected to the rest of the body. So what is mental illness is primarily when you have a abnormality in the limbic or the middle part of the brain, not exclusively, as I said, they're connected. And that would be expression of sadness, anxiety, psychosis, unusual fears, etc., etc. So that is what brain disease, particularly psychiatric illnesses or mental diseases are.
Yeah, so that's the, I mean, from the way you described it, that you talked about the brain as a part of the body and the different parts of the brain itself and how it relates to the things we can either see or not see. And so talking of that, is this different from other illnesses that, other diseases or other illnesses that we have in other parts of the body? Is it different?
It's not. For several reasons. First of all, brain is part of your body, as heart is and kidney is, okay? And any part of the body can become disease, like any part of your car can break down, any part of your computer. But there is a very good, let me explain to you an analogy of how one part of body not functioning properly causing diabetes, let's say pancreas, and then a mental illness. So let's see this. So pancreas is supposed to ooze out insulin. It excretes out insulin to digest your food. If it does not, you have symptoms. Similarly, brain oozes out neurotransmitters. So for example, say most common dopamine or serotonin. Okay, now let's go back to pancreas. It sits here, right here, where your center of the, it's by the liver, near your rib cage. When you don't have enough insulin produced by the pancreas, you do not feel pain here. You may have symptoms way far away. You may have increased thirst. You may have increased urination. You may feel fatigue. Your wounds may not heal properly. But the problem is coming from here. All those symptoms are body's way of signaling to you that there is something wrong with the body. Look at it, fix it. Let's go back to the brain. When it is not giving enough serotonin or dopamine, and I'm using these two just an example, you do not have headache here, but you have signals coming out from the body elsewhere. And these signals are coming in the form of the emotional disturbances. So you can have anxiety disorder, which is body's way of telling you there is something wrong, fix it. You can have depression. This is body's way of saying their symptom is coming from something that is not working properly. So this is one way of looking at these two parallels. Let's look at more scientifically. We know certain diseases of the body are genetically related, heart disease, dementia, and so are psychiatric illnesses. You have family members who have psychiatric illnesses, and then your probability increases because there is genetic predisposition. Now, that is an important thing. It means there is a genetic mutation somewhere that has caused a disease. In my family, I have heart disease. In somebody else's family, it may be depression or bipolar disorder. or dementia. So there is the second parallel to see how they are mirror images of each other: body disease, brain disease, genetic predisposition, right? And then of course consequences. So if you don't treat diabetes, you will have problems, because like if you have your car saying check engine sign, if you don't fix what is wrong, it is going to break down and you will have a bigger problem. Similarly, if you do not take care of the signs of diabetes, which I said, increased thirst, fatigue, wound not healing, you're going to get in more trouble. Similarly, when the body's part called brain giving you signals, it will become very important to take care of that is not working properly. So all these signs are actually signals that the body is giving out so that you seek help and make it function properly. It is like a fire alarm that goes off. There is smoke somewhere, find the smoke, otherwise it could be a big fire. So there is like, and we in practice view brain disease as any other disease. So let me talk about, on that context, within the brain, you can actually see how the neocortex, the most recent part, and the limbic cortex, or the second brain, how parallel they run. So think about it. Everybody knows what a seizure is, epilepsy, right? What is it? It is the neurons in the part of the brain that, for example, controls the arm, fire abnormally. There is abnormal firing of the neurons, and if it happens to be in the area of the brain that controls the arm, you have seizure. We see it, we treat it. Now think about if there is abnormal firing of the neurons in the second brain, where the limbic system is. This is the sign of a seizure, because the neurons that control the arm are not working properly. But a manic episode will be a sign of the abnormal neuronal firing in the area that just expresses itself by emotions. And Dio, that we use medicines that are seizure medicines to control a psychiatric illness called bipolar disorder, because we are trying to control the abnormal firing of the neurons that is not causing this, but causing emotional upset. So see how closely they are mirror imaged to each other. Now we as a human species, we are Homo sapiens sapien, we are highly evolved species. So let me make a third parallel. We made the first parallel of diabetes, second parallel of different parts of the brain. Now I'm going to make a third parallel to see how mental illnesses or brain diseases equate other diseases. Think of it this way. If you have a very small, very rudimentary 50-year-old computer, the things can go wrong with that computer are few, because it's not that complex. That is your animal, that is a rodent, a snake, maybe a deer. That species has not evolved to the point where human is involved. So this small computer that they have in their brain, we became the computer of 2020. It is more complex, more drives, more work, more memory, more of everything. We are reaching Mars. We are getting into the bottom of the oceans, not because we have strong arms or strong kidney, but because our brain has evolved. So when you have evolved from a small computer to a very big computer, it is only logical to think that many more things can go wrong with it. And that's why we have so much evolution of brain diseases. We know diseases that we did not know before. Because people did not live to be 95 years, 85 years. Now we have so many people. And this computer that they brought is now working for so many years. Obviously, more things are bound to get wrong. More fixing needs to happen. So this is the third parallel of a small computer, which can have one or two functions, to evolving into a very big computer. And therefore we need to be cognizant that yes, it's a complex organ and many things can go wrong. Some of things you will see and some of things you will feel. So that is what brain diseases are, certain parallel to that.
Good, good. I mean, I like that. And I mean, you told us, you just also explained how important it is to pay attention to the signals, because the next question I was going to ask is, why should we be concerned about mental illnesses, or when we get those signals? And just to add a little bit to that, are there ways that we can prevent it in the first place? Can they be prevented? And when we get the signals, why should we pay attention to it? Why is it important?
Right. So a number of things. I made notes so that I don't forget things, because this is very important for me. Let's say you get temperature and you have fever.
Right.
Fever in itself doesn't tell you anything. It tells you there is some infection somewhere. It could be infection in your lungs, pneumonia, or down in the toe. You as a physician and I as a patient need to figure out, where is this temperature coming from? So the same happens with the brain diseases. We need to figure out where the signal is coming from. But why is it important for us to pay attention to brain's health? And if it is diseased, to treat it. So a number of reasons. We humans are, as I said, highly evolved. The most important organ in your body is your brain.
Thank you.
It controls almost everything. It controls your heart, your blood pressure, your breathing, your temperature regulation. It controls your sleep cycle, your vision, your smell, your touch. I mean, what would you be if that computer did not work? Called brain. That's number one.
Yeah.
So the fact that somebody is the president of the country and somebody is homeless is not because their kidneys are different or their liver is different. Given all the circumstances same, it is how you have used your brain. Yeah. So the importance of that is that, look at nature. When you look at nature, Dayo, you learn a lot. So think about it. Your stomach is not covered with any bones. Tummy is free. It's open. Your muscles are open. Your genitalia are open. The heart has rib cage, but there is flesh in between. There is one organ that nature has given a helmet for. Complete protection from possible injury, and that is your skull, your brain. Why? Because nature knows it is the most important organ in the brain. If this, in the body, if this goes, everything goes.
That's a good
Yeah,
one.
think about it. Nature can teach us a lot. So that tells you, yes, you need to pay attention to the brain's health. I'm going to give you a couple of examples.
Okay.
If you do not sleep well for 1 or 2 nights, what happens to your body? It's not fully functional. It's not optimal. If you are under stress, what happens to the concentration and decision making? Not that good. And we are decision makers on the earth. Okay. So now, why do we have to pay attention to it? Of course, the person who has a brain disease, a mental illness, for example, depression, feels terrible. It affects the functionality of that person. Brain diseases or mental illnesses affect almost every other function of body. If you have pain from a real injury or a chronic pain, and if you're depressed, you will feel more pain. If you have, for example, irritable bowel syndrome or gut problems, if you have anxiety, you will have more gut symptoms. We treat many patients with gut problems with anti-anxiety medications. Right? If you are under stress, depressed, it will affect your blood pressure, of course, and the heart disease. And finally, when you are under stress, and that is also part of the brain, we can call it anxiety or depression, it changes your hormones, the cortisol, the inflammation. Inflammation is a mother problem that affects almost all diseases. So obviously, you're not only feeling bad by having those diseases, but your brain disease or psychiatric illnesses or mental illness is affecting the rest of your body. But there is another very important reason that I think is worth mentioning that tells you why taking care of your brain health is more important, or a lot important, than any other organ of the brain, of the body. So think about it this way. If I have a fracture here, my bone is broken, I will feel the pain. So I will have the distress. There will be also loss of functionality. I will not probably be able to use this arm. It stops here. Contrary to that, if a mother has psychosis, for example, or mania, or if the father has alcoholism or severe depression, that person is feeling it. It is making that person less functional, but this will affect everybody in the household. Think of a child who grows up with a bipolar parent, or a psychotic parent, or a father who's alcoholic. The impact is not restricted to the person who has disease. It has a ripple effect which is very real. It is not easy to live with a depressed person. It is not easy to live with a person who's obsessive compulsive and makes you check the lock 50 times a night. It is not easy for a person who has phobias. So the effect on the household and on a larger scale is many folds.
Right.
I have an advice for people who are in healthcare. If you prevent this or treat this disease of brain or any disease of the brain successfully, you have not only done good for the patient, but you have done a greater good. Your impact on society multiplies. And that is the reason I went into psychiatry. And now on the other extreme, if you have a child who has some psychiatric illness, for example, autism, mental retardation, childhood bipolar, being a parent, you can only think of what kind of impact it will have. And of course, other siblings who are also growing and learning. The other side of the extreme, if you have a parent who is, let's say, old, 85-year-old, and has dementia, which is an illness, a mental illness, and taking care of that parent will have enormous effect on the caregiver. So my point is that these are the reasons why we need to be fully aware of mental illnesses and really proactively treating them. In terms of prevention, the first thing we are doing is getting knowledge. We have to be aware that these diseases exist, and there are a number of things that person can do to make things. In other words, what you do is you make your life comes close to the optimum best practices. So for example, going back to diabetes, you have genetic predisposition, you cannot do anything about it. But if you maintain your weight on the lower side, exercise regularly, don't eat too much sugar, your chances of diabetes expressing itself as a disease or becoming more complicated diabetes is much less. Similarly, in the psychiatric illnesses, if you do not do drugs, for example, and alcohol, you are decreasing the probability of having a psychiatric illness. If you have some symptoms and you get treatment right away, all psychiatric illnesses progress to become worse over the course of time. So taking care of it from the get-go makes it a less offensive disease. Right? And then also in terms of everyday life, how parenting should be, how sibling-parent interaction, that knowledge. Teachers, you do not want to shame a child who's having problem. You want to be aware of this as a disease. And finally, my final point on this is, if somebody, for example, has diarrhea, you don't say to that person, stop defecating. We say that to people who are depressed, snap out of it.
Right.
There's nothing to be depressed about. Why are you depressed? Why are you anxious?
Mhm.
It goes back to what we see. We do not say that to somebody who is bleeding because we can see the blood.
Right.
But psychiatric illnesses, we feel that the person should be able to control with his or her will, which is not really doable. I mean, there are things that one can do to make it better, like diabetes. You don't eat a lot of sugar and cake and pastry. You can do that with many psychiatric illnesses. You can create a life that is more in line with the hygiene, the mental hygiene. I'll give you another example. On that part, what can one do? Sleep. 1/3 of our lives is spent in sleep, about 8 hours. 1/3 of the life is sleeping. Now, there's a reason why nature wants you to sleep so much. You could be more productive for the nature if you harvested and you drove and you did work, but nature wants you to sleep for 8 hours because there is enormous amount of benefit of sleep. You're charging your phone like you're charging your body. It balances out, it repairs itself. So those of us who have developed habits of neglecting sleep because we are talking to people, watching movies, drinking coffee at 8 p.m. This can be changed to do what we call sleep hygiene, which in turn will help you sleep better, which in turn will keep your brain healthy. So once we understand the importance of brain and what kind of organ it is and how biologically it is similar to any other part of the body and how its diseases can affect not just the individual, but many other around, then we need to take care of the brain. And for example, in this case, sleep is where the brain is refreshed, it gets recharged. So changing lifestyle will help us creating more brain health. Does that answer your question?
Yes, it does. And you touched a lot of points that I'm excited you brought up that you highlighted. You talked about sleep. You talk about the education system, how they should not be shaming children, and that is also another place where people can identify things early and be able to intervene at an early stage. You talked about parenting style. You talked about alcoholism. You talked about a lot of stuff and how prevention is really it's a multifactorial issue. So I'm excited you said all those things. But before we go ahead before I ask the last question about you advising healthcare professionals and the general public, I want you to please tell us a little bit about the factors that contribute to mental illnesses. You've mentioned the genetic factors, you've mentioned environmental factors, but I want you to please highlight that so that people can understand that taking care of this thing can help improve or promote mental health, and at the same time maybe it can contribute to mental illnesses, and if any of this is going on, for them to be able to intervene early. What are these factors? What are these factors?
Yeah, so it starts from really conception. I mean, the age of the parents starts the older, the two extremes. If you're way too young or way too old, then you can have offsprings that may not be that healthy in many organs, including brain. The second is prenatal care. I mean, for example, folic acid. When we give multivitamins to a pregnant woman, there is a vitamin called folic acid that is in there. Now, what does folic acid do? It makes the brain grow. It is important for the brain growth. So if you have folic acid deficiency, you can have abnormal growth of the brain. Prenatal care is going to be an investment for the child that is being born. I think when you are bringing another human on the face of the earth who may live for 80, 90 years, it is worth investing those 9 months to the fullest attention. Yeah?
Yes.
So you've been a mother, perinatal care affects brain like any other organ and therefore can have effect on how the patient's emotions are. Then of course the delivery, so you want to be the brain not go on hypoxia, for example. So the whole delivery process. My advice at that point will be for anybody who is planning to become a parent, now that we have internet so much, spend some time and learn some parenting skills. Emotional support for the child. It's amazing how much brain grows in the first 4 years of life. It grows very fast. So the child is observing. Child from the birth is not a piece of furniture. Child is observing everything. Yeah, they are observing your body language, your words, and the way you handle it. So parenting becomes, and parenting issues can, abnormal parenting issues can become other psychiatric illnesses for the child in future. From that point on, you have to, best thing, you have to be aware of mental illnesses, the signs. Of course, I'm emphasizing on correct parenting skills, but then also signs of what could be a childhood illness. It is not anybody's fault. Any brain illness is not anybody's fault. You do your best to prevent it, but you don't have to, parents don't have to blame themselves, especially in many cultures, women is blamed for giving birth to a child who may not be normal. It's very, very non-scientific. What all need to do is to understand that it's like any other disease, you got to identify and then take care of it, whether it is non-pharmaceutical ways or pharmaceutical ways. Going forward, everybody around the child, the family members, they also need to be knowledgeable as to how to raise a child. So some time ago, 50 years ago, punishment was considered a golden standard. Now it's not. Positive reinforcement works better than the negative reinforcement. School teachers, I wish I could come to you and go to every school teacher and tell them what is bringing up a child like. If you look at it in the number of hours, a child spends more hours with the teacher than with the parent. So teacher is like a foundational block in a child's life. So awareness of illnesses, not shaming, for example, not blaming, rather helping the child becomes enormously important for the teachers.
Right.
So,
and with them, like issues of bullying and things like that, if they can, in schools, if teachers and educational leaders can also look into that, I think that's affecting a lot of children too.
If we can educate teachers, your 50% of your work is done.
Okay.
But let me. I'm gonna divert here and want to talk about why people shame others with mental illness. Why is it? Isn't it enormous? Every culture has it. I mean, even today in the United States, it's a taboo to have a psychiatric illness.
Right.
Why is it? Here's my understanding of it. We humans know deep down that we are evolved because of our brain. We cannot run as fast as a horse, but we have vehicles, a car, because the brain invented.
Yeah.
We cannot bite as powerful as an alligator, but we have cranes that can crack stones. Not because we have muscles, but we have brain that created that machine. So deep down, we know that the most important asset with us is our brain. And therefore, when we see somebody whose brain is not working properly, we feel that person is an inferior species.
Right.
We do not do that with somebody who's on dialysis. Kidney isn't working. But we do that with the brain functioning because deep down, not known as an obvious as I'm saying, right, but deep down, the currency of Homo sapien, the reason Homo sapien is Homo sapien sapien is because of the brain. And so if the brain is not working properly, that person has, in our opinion, come down on the tier or a hierarchy. and so if we understand that, at that point, the teachers and the parents need to look at it other way around. So, okay, this is a brain that is not working 100%, not fully efficient. Let's bring it up so that it becomes the most functional that it can, rather than putting it further down.
Right, right. Good, good. Thank you. Thank you. That's very important. So on that note, what advice would you give healthcare professionals?
Yes.
And then for every I think I fall into what category? As a healthcare professional and as a general public, just as a parent, as a regular person, everyday person, what advice do you have for us?
Yes, the first advice is to really understand what I'm saying, that yes, these are diseases that happen like any other organ. Because when a patient goes to a healthcare provider, at that point, that doctor or nurse practitioner or physician or somebody who is giving advice is word of God for that person. It is important. Your body language, the way you value something or the way you devalue something, has an enormous impact. So healthcare providers, I think, should go with that understanding that psychiatric illnesses are serious illnesses. It is not the judgment of the person who has it. You may not like it. The person may be nasty if it is fully manic, or accusing you of killing because the person is paranoid, which is a sign of psychosis. But it is still a disease. It doesn't label the person. It is not the person, it is the disease. Okay. Number two, what you say to the patients and their relatives makes a difference. So healthcare providers are superpowers. They have so much influence on normalizing mental illnesses. If they do not normalize mental illness, public will not. And my final advice for mental health or healthcare providers would be, understand that the disease of psychiatric illnesses affect every or almost every other disease of the body. So when you see a person coming to you for uncontrolled blood pressure, for example, look for anxiety. If somebody is coming to you for multiple different complaints that don't make sense, it can be a psychiatric illness.
Right.
If a person has pain that is not going away, it can be a psychiatric illness. It can be an expression of depression. Mm-hmm. If a person is coming to you, or a child with multiple bruises multiple times, the parent may be a psychiatric patient.
Right.
Okay. So just being aware that these things affecting your patient who comes from a complaint of remote part of the body is still connected to the brain, and brain is connected to the body. So this becomes quite a routine. And once the healthcare providers pay attention to it, it may take a little bit time in the initial phase, but once they become cognizant of it and do practice, these things can happen without consuming a lot of time. And we as healthcare providers want our patients to get better. That is where we get our refueling. This is what gives us the energy to do more work. So you may give your patient who is having frequent diarrhea some medicine, but if you do not look at what the brain is doing to that GI tract, your reward of treating that patient will not be 100%. Mm-hmm. So you as a healthcare provider also get something from treating the person as a whole person. Do not neglect the power of brain on any part of the body. And I think if we all do that, just this awareness and this knowing, this screening questions, this observation, I think we can make a big difference.
A big one. I agree with you. I agree with you. So what about for us regular day people, mothers, fathers, leaders? What advice would you give us?
Acquire knowledge, learn how these illnesses express themselves. You do not have to feel overwhelmed, but if it is there and you have the knowledge, you will identify. And if you find a healthcare provider who is also on the same page with that, it can make a big difference. Never blame anybody for any illnesses, including psychiatric illnesses, because blaming doesn't do anybody any good.
No.
Take it as an organic, abnormal functioning of a body part. In this case, it happens to be brain. And in this case, it happens to be emotional expression of that abnormality. And take it as any other organic disease problem.
Right.
It also gives you as a caregiver, as a parent, a barrier that you do not feel guilty.
Mm-hmm.
Guilt will affect you. I think you have another speaker sometime.
Yeah. Yeah, I have another. Yeah, that will be talking about that. Yes, we'll have her coming in and she'll share a lot. So you're saying, I want you to speak with one thing as we finally round up this, about when people just think that seeing a psychiatric a professional or a mental health professional is like a taboo. Would you please tell people that we are just like every other person, and it's okay, both for the person that wants to seek help and for the person outside, not to think that those seeing psychiatric or mental health professionals, that they're abnormal?
So it's not easy. If I say to you, please don't do it, then it is not easy. And the reason it is not easy, as I mentioned, we deep down are aware that brain is the most important. It's the currency of you being superior. When it is not working, it is very difficult to admit that you are not superior. It affects our core value for our own selves. So when you go to see a psychiatrist or a psychologist or somebody who deals with the brain diseases that you cannot see with your eyes, it shakes up the core of your own importance, value, and your usefulness. And multiply that when you are taking your child to see a psychiatrist or a psychologist. It cores your importance because it is now going into your child. So it is not easy. But what makes it easy is to understand that this is an abnormal organ and it can be helped. I think when people start to practice, it takes bold steps to practice this, to come out of this very difficult shell and come out and seek help and talk about what you are doing today is talking about it. And I'm hoping that many of these conferences will happen. And when you do that, becoming aware of these biological diseases that can be helped with biological treatments, like any other medicine, that will help. So talking, normalizing, seeking help, seeing results.
Right.
I think the results are awesome with psychiatric illnesses. Better than many other diseases. I mean, think about it. If you are hypertensive, how many times you take the medicine every day and still have days when your blood pressure is high? Many times. It never goes away. You are hypertensive, you are hypertensive. If you're diabetic, you take insulin for 30, 35 years, you miss 2 days, you're in the emergency room with hyperglycemia. Comparing to all of those, psychiatric illnesses are wonderfully covered. We do not see many so-called psychiatric patients on the streets anymore. They are in the offices, in the banks, in teaching schools. They are highly functional.
Right.
So when we can give results to the audience, to the general public, it will help them to normalize how well these diseases can be controlled.
Right, right.
So awareness, knowledge, practice, and results, all collectively can really make a difference.
Awesome. Awesome, 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 awesome. Thank you. Thank you so much, Dr. Khowaja. You touched even, beyond what I was hoping we'll get to. And I hope that our audience already got a lot of information from this. And to everyone watching this, or everyone who got this information and got this knowledge, please go out there and also be ambassadors for mental health issues. It is, we like he told us that, you know, when one person is affected, it affects the whole family. So this is a relational issue. So when you're intervening in one person's life, you're actually saving a family, a community, you know, and the ripple effect is huge. So every one of us, we have the power to do something. First, with ourselves, you know, look within and do what we need to do. And second, you know, to the family. And then on a broader scale, everywhere, every community you find yourself. So please do something. I mean, bringing Dr. Khowaja here to share all this with us is really huge. And I do not want it to waste in any way, or anybody that's listening to this. So thank you for listening. Do your best, go out there. And again, I thank Dr. Khowaja for honoring my invitation, speaking to this wonderful audience. I'm sure a lot of questions are waiting for us, and a lot of questions will come up, and I would make sure to get all this to you, and we can give people feedback. And if they're requesting anything, I would let you know. And I trust that you will honor this again if we request you to come in future.
I want to end with one example, a live example, which I saved
sir.
at the end.
Okay.
Do I have a minute?
Yes, yes, please, please.
This attorney wrote it, so so this happened in Texas. There was a guy who was on death row because he killed somebody, and he was finally executed. And the attorney who represented him told this story. When this guy was 5 years old, his mother took a butcher knife and screaming, yelling that she's going to kill him. He put himself in a bathroom, locked the door, 5-year-old child, and screamed for help till the police came. The mother had a psychiatric illness called paranoid schizophrenia. The child was chased by his own mother with a big knife, screaming for help to save his life. She went for treatment. He then started to live with his older brother. When this guy was 9 years old, the older brother shot himself and died. Why? Because these illnesses can be genetically related.
Right, right.
This 9-year-old now lived alone. He became a gang member and he killed somebody and he was executed. If this mother was treated, and we have successful treatments for schizophrenia now,
Yeah.
look at the impact. The last impact that he killed somebody also had a whole family. They lost one person.
Right.
As I'm talking about it, I feel so emotional about it. And those things are not uncommon. This happened in Texas, by the way. So, but
Yeah.
thank you so much for doing all this. I hope things go well.
Yes, thank you so much. Thank you so much. And thanks for this. I'm sure it drives everything you've said. It drives it home and makes it real. We can see it now, like you said. So thank you so much, Dr. Khowaja. And thank you all for watching this. And we'll be answering your questions sooner, very soon.
Thank you very much. Bye-bye.